Back injuries can be devastating. No position to get comfortable. You can't sit down very long. You can't stand up very long. You can't lay down sometimes. You can't lay on your side, and you're miserable. Some people have serious back injuries that require surgery. Sometimes a surgery is necessary to maintain function of a limb. For instance, the distribution of the L5-S1 nerve that comes out of the bottom part of your spine controls your legs. If you have an injury to that portion of your spine, your legs won't function, and if it's ignored, you might never regain that function. The way to diagnose back injuries, we've got MRIs, we've got myelograms, we've got CAT scans, we've got x-ray, we've got all of those things. But sometimes the challenge is for the doctor is diagnosing the patient's symptoms and comparing that with the radiographic studies. You can have a disc in your back, L4-5, the second to lowest vertebral. And the MRI says that disc is herniated, it's touching on the nerve, and you should have really bad pain in your leg. But the patient doesn't have pain in their leg. But the L3-4 disc, one right above it, doesn't look so bad, but the guy's having pain at the other part of his leg that is controlled by the L3-4 vertebra. So what I've learned from all these doctors that I've deposed over the years is that the doctor should treat the patient, not the MRI. The way it's been explained to me is the test is only so good. The MRI is a test, and it can only see what it can see. If the patient is not having symptoms, don't treat the test. Don't go operate on the disc that the test says is bad. Operate on the disc you know is causing the symptoms. The patient will tell you what is hurting and why it's hurting. It's a puzzle, and it requires a good doctor, and it requires a patient to give an accurate description, again, an accurate history, and that's the fight sometimes with the opposing doctor. The other doctor will say, well, this MRI shows that this is the worst of the two discs. One is causing a symptom and the other one is not. So should you operate on the one that is not symptomatic or the one that is? So that's a challenge that comes up, and that's the argument that is often presented by the opposing party, is that you got the wrong disc because the test says it's not the one that is injured.